These are the matching exercises for the nervous system, beginning on page 250. Exercise A, match the term in column 1 with its description in column 2. Number 1, cerebrum is letter C, the largest part of the brain, controls body movements, thought, reasoning, vision, hearing, and speech. 2, spinal cord is letter B, collection of nerves that are within the spinal cavity surrounded by backbones. 3, the cerebellum is letter E, lower back part of the brain that controls muscular coordination and balance. 4, medulla oblongata is letter A, the lower part of the brain nearest to the spinal cord. It controls breathing and heartbeat. And number 5, spinal nerves is letter D, nerves that transmit messages to and from the spinal cord. Exercise B, match the combining form in column 1 with its meaning in column 2. Number 1, cerebello is B, the cerebellum. 2, medullo is E, medulla oblongata. 3, myelo is letter D, the spinal cord. Number 4, cerebro is letter F, the cerebrum. 5, encephalo is C, the brain. And number 6, neuro is A, nerve. Exercise C, match the medical term in column 1 with its meaning in column 2. Number 1, myelitis is D, inflammation of the spinal cord. 2, cerebral is letter B, pertaining to the largest part of the brain. Number 3, medullary is letter F, pertaining to the lower part of the brain closest to the spinal cord. 4, encephalitis is letter E, inflammation of the brain. 5, neuropathy is letter A, disease of nerves. And 6, cerebellar is C, pertaining to the posterior portion of the brain that controls equilibrium. Exercise D, match the pathologic condition in column 1 with its meaning in column 2. Number 1, cerebrovascular accident is letter E, damage to blood vessels in the brain, a stroke. 2, multiple sclerosis is letter F, destruction of myelin sheath around nerve cells in the CNS. 3, concussion is letter G, blunt injury to the brain severe enough to cause loss of consciousness. Number 4, syncope is C, fainting. Number 5, epilepsy is J, a chronic brain disorder with seizure activity. 6, meningitis is letter A, inflammation of the membrane surrounding the brain and spinal cord. 7, glioblastoma is letter I, malignant tumor of the brain. Number 8, paraplegia is H, paralysis of the lower portion of the body. Number 9, hemiplegia is letter D, paralysis on one side of the body. And 10, Alzheimer's disease, is letter B, a brain disorder marked by deterioration in mental activity, which is dementia. Exercise E, match the test or procedure in column 1 with its description in column 2. Number 1, lumbar puncture, is D, procedure to remove cerebrospinal fluid, measurement of pressure and injection of contrast. 2, CSF analysis, is B, chemical tests, cell counts, cultures, and smears of fluid surrounding the brain and spinal cord. 3, cerebral angiography, is E, X-ray image of blood vessels in the brain after injection of contrast. And 4, electroencephalogram, is letter C, record of the electrical activity in the brain. 5, PET scan, is letter A, uptake of radioactive material in the brain shows how the brain uses glucose. 6, MRI, is letter H, magnetic and radio frequency waves create images of the brain and spinal cord tissue. 7, stereotactic radiosurgery, is letter I, non-surgical type of radiation therapy used to treat abnormalities and small tumors of the brain, also called CyberKnife. Number 8, CT scan, is letter G, cross-sectional X-ray images of the brain and spinal cord. And number 9, TENS, is letter F, a battery-powered device delivers stimulation to nerves to relieve acute and chronic pain.